Hello, my name is Meghan Wunder and I am one of the nurse practitioner students at Simmons University. Today I will be performing the abdomen, musculoskeletal, and neurological exam on my patient, Kenneth Morales. Before I start, Kenneth, I just want to confirm, do I have your consent to record this for educational purposes?
Yes.
Awesome. Okay, so we're going to start by observing, first inspecting the abdomen as we always do by inspection first. So I am going to pull this up just so I can look at the abdomen. Can you move your arms, please? Thank you. So I'm going to start off by inspecting. I noticed that I don't see any redness, any swelling, any masses from inspection. With the abdomen procedure, what we do is inspect, auscultate, percuss, and palpate. We never want to palpate before percussion, as this can cause pain if there is inflammation. So what we always want to do is save palpation for last. So what I'm going to do is I'm going to auscultate all four quadrants. I'm going to start in the right lower quadrant, move up to the right upper quadrant, move over to the left upper quadrant, and down to the left lower quadrant. After I am done listening to those four quadrants, I'm going to also auscultate above the umbilicus at the aortic area to listen for any bruits. So I'm going to not only auscultate the four quadrants, I'm going to listen to the aortic area as well as the renal areas on either side, and then we're going to move further down and listen to the iliac areas. So I'm just going to do that real quick. And what I'm doing when I auscultate is listening for activity in the bowel sounds, specifically how active the bowels are. This patient had bowel sounds ranging between 5 and 30 gurgles, I would say, per minute, so that is normal active. So I'm now going to listen to the abdominal aortic area. And I'm also going to flip over to the bell to listen. And what I'm doing is listening for any bruits, which is turbulent flow. And I don't hear any. And now we're going to move down to the renal areas. And lastly, the iliac areas. Good, okay. All right, so now what we're going to do is we're going to percuss the four quadrants as well as percussing the liver and the spleen. Now, so what we're going to do is we're going to take our hand and we're going to lightly tap. And we're going to be listening for tympany. Now, if we notice any dullness, that is not what we want to hear. That is an abnormal sound. So I did hear tympany, so that is a normal sound within the patient. What we're going to do is we are now going to palpate, as this is the last step. And I'm going to start as I was doing and start in the right lower quadrant and work my ways clockwise. So I'm sorry, my hands might be cold. We're going to start with light palpation. This can help to get out any of the giggles. If patients are ticklish, it can kind of give them like a little bit of a heads up. And then what I'm going to be doing is deep palpation. So I'm going to be feeling deeply. And what I'm going to be doing, so the liver is on the right side of the abdomen. What I'm going to be doing is I'm going to have the patient take a deep breath in, not yet, I'll tell you when, but I'll have them take a deep breath in. And what I'm going to do is almost curve my fingers like this, and we are going to go up and under the last rib in order to feel the liver. So I'm going to have you take that deep breath in. And what I'm doing is when he does that, I can actually feel the liver move downwards, which I just felt. So I am able to palpate that. The liver normal size is between 6 and 12 centimeters. And then the other thing I'm going to do, you can breathe normally, is I'm going to palpate for his spleen. Now, in a normal patient, you should not be able to feel the spleen. If you do feel it, that is abnormal. So I'm going to do, just like on the right side, I'm going to palpate. I do not feel the spleen, so that is a normal finding. And then I'm also just going to palpate down the colon. Sometimes this can be a little tender in certain patients, but it should not cause any pain. So, all right, thank you, Kenneth. I'm going to cover you back up. So what I'm going to do now, we are now going to move kind of down the body. I'm going to test some of your musculoskeletal reflexes. So I'm going to actually have you just sit up. You can stay sitting on the edge of the couch for me. Good job. So what I'm going to be doing is I'm going to be checking out your neck, your shoulders, your elbows, your wrists, your fingers, your knees, your ankles, and your feet. So we're going to be going pretty much from head to toe. You just follow all the commands as I state them, okay? So what we're going to do is we are going to be doing, we're first going to be doing the neck. So first I'm going to inspect the neck. The trachea appears midline. I don't notice any deviation with the trachea. You just look straight forward for me. So I don't notice any redness or erythema. What I'm going to do, I'm next going to palpate the neck. I don't notice any nodules, masses. Trachea is midline. Okay, good. So I'm going to have you, we're going to be doing all of our flexion, extension, rotation, all of that. So what I'm going to have you do, there's going to be a lot of just following directions, okay? So I'm going to have you turn your head from side to side. Good job. Now I want you to look upwards and downwards. Now this is extension looking upwards and flexion looking downwards, and then rotation looking side to side. Can you now take your head and look, almost bring it ear to your shoulders if you're able to on both sides for me? Good. And that is internal and external rotation. And then what we're going to do now is we are now going to move down to your shoulders. I'm sorry, for the neck, one more thing, just try to turn your head this way against my hand's resistance. Good. And try to turn it the other way against my hand's resistance. Good. All right, so now we're going to move down to shoulders. I'm going to inspect your shoulders. They appear equal, and they do not appear that one side is higher than the other. All right, I am just going to press on them just to feel them. Okay. What I'm going to have you do, I'm going to actually kneel down to make it a little easier. What I'm going to have you do, so I'm at eye level, I want you to twist back and look back on both sides. Good. And this is also part of a spine examination as well, because it is working the spine. So I'm going to have you shrug your shoulders against, good job. All right, so what I'm going to have you do, I'm going to actually back up. I'm going to stand right here just so I can be looking at the camera. I want you to take your hands and move it upward as high as you can go. Good job. Now this is flexion, and I want you to bring your arm backwards as far back as it can go. Now the patient did have shoulder surgery, so I'm not sure how far back he'll be able to move it. That's pretty good. And that is extension. I'm going to have you move your arm outwards. This is abduction with a B, abduction. You're going to bring it now towards your body. This is adduction with a D, like adding, so you're adding it to your body. You're going to hold your arm out straight in front of you, and I want you to turn it over. Good. Now this is rotation. This is also supination, pronation, so we can see that you do have full range of motion with your arms. Good job. So now what we're going to do, we're going to move down to your elbows. I'm just going to be inspecting them. I don't notice any abnormalities or misalignment with them. I am just going to palpate them. Okay. And I do want to just go back to the shoulder there. I want to palpate. I can't remember if I said it, but I want to palpate, make sure that I don't feel any masses or abnormalities. Good. Okay, so I don't feel any masses or abnormalities with the shoulders. Moving back down to the elbows, I'm just going to palpate like I was talking about. Alrighty, I'm just going to palpate this side. Okay, so now for the elbows, pretty much the same thing as for the shoulders. It's going to be a lot of repetition. I want you to bend your elbow at an angle like this in front of you. Good. Now I want you to swing it outwards.
Both arms?
No, just one. You can do just one arm. Just swing it outwards. Good. So this would be, and I'm now going to have you swing it back across and almost grab your shoulder and twist. Good. So now we're going to have you bring your elbow up. Good job. And I want you to bend it down. So we're doing flexion, extension. We're doing adduction, abduction. Abduction and adduction. We are now going to move down to your wrist and your fingers. So I'm going to have you hold your arms out like this. I'm just going to examine your wrist. It's just a little hard because you have a watch on. Oh, no, that's fine. Okay. So I'm just examining the wrist. I don't see any redness, erythema. I don't notice any anomalies. And I'm also going to examine the fingertips as well during this because I'm going to combine it just for the sake of time. So I don't notice any bulging masses on the fingertips. I don't notice any swelling, redness. Now I'm going to palpate the wrists as well as the fingers. You can just relax your arm. I'm just going to kind of move you around. All right, we're going to palpate these wrists. And now I am going to palpate the fingers. Now he is a younger individual, so there is less chance for him having osteoarthritis as well as rheumatoid arthritis. But if he has any pain or tenderness in his fingers, this is the point where he would tell me in the exam. All right, so we are going to, I'm going to face you again. We're going to take our wrists, we're going to turn them outwards, and we're going to turn them inwards for rotation, internal and external rotation. We're going to flex, extend upwards, and we're going to flex them downwards. Good. Now we're going to take our fingers, and we're going to move our wrists in a whole big circle. Good. Now we're going to take our fingers, hold them like this, and actually you can close them. Good job. And I'm going to have you spread them as wide as you can. This is abduction. We're going to have you bring them back together, which is adduction. We're going to have you just bend the fingers. Good, just to make sure we have full range of mobility. And what I'm going to do, I want to test your strength with, we already tested your shoulder shrugging and turning your head against resistance. So I want to test your hands. So I'm going to have you hold your hands up like this. I want you to push against my hands, giving resistance. So push as hard. Good. Now I want you to hold your arms up like this and pull back against my arms. Good. So he does have strong ability to pull against resistance for his wrists and fingers. Now we are going to move down to your hips, knees, and ankles. So for the hips, what I'm going to have you do, I'm just going to have you stay sitting for a moment, and I'm just going to examine the hips just to make sure I don't notice that one side is higher than the other. All right, so now I'm going to have you stand up for me, and I'm actually going to fully be able to examine, it's kind of hard with the ankle, I'm going to be able to examine, thank you, the hips. I might actually have you just stand here, and I'm just going to examine from the back, make sure that the hips are equal. And while I'm back here, I'm going to turn you a little bit, I am just going to examine his spinal process. So examining first, it is a little hard just with the shirt on, but I'm going to speak just the process. So examining first, I don't notice any malalignment. I notice that the shoulders appear equal, just like when we did the shoulder examination in the front. What I'm going to have you do is I'm going to be palpating from the top of the spine all the way down to the sacrum, so you are just going to feel my hands. And I'm going to use both hands for this just to ensure that I can feel the spine. Okay, now what I'm going to have you do, Kenny, I'm going to have you bend forward as if you're touching your toes, okay? Okay, and this is a great part of the exam where you can actually see if they have scoliosis. So I'm still going to make sure the spine is not bending anymore or twisting any more than normal, and it is not. I'm going to have you stand back up straight, and you keep facing that way, and I want you to actually lean back a little bit, okay? I want to test, can you lean back any more? You can put your hands on your hips if you need to in order to stabilize yourself. Good job. Now I'm going to have you turn, and we're going to move from side to side. Good. And I want you to, if you're able to, turn and look behind you for rotation. Good job. And then the bending forwards and backwards tested flexion, extension, as well as the turning for rotation. All right, so now we're going to have you sit back down just on the edge of the couch for me, please. Good job. We're going to test your knees. All right, so I'm going to have you put your hands here. I'm going to just examine them first, make sure I'm in the camera. Knees appear equal bilaterally. I don't notice any visible trauma to them. I am just going to palpate them, just the processes. And actually, while I'm here, I am going to be testing the reflexes. So we'll be kind of going out of order, but this is just where I'm at the exam. So after palpation, I am just going to test your patellar reflex. So you just stay nice and still. I am just going to hit it a little bit. Sorry, it might hurt a little bit. But it should, as you can see, he should flinch a little bit. So that is the patellar reflex. We are also going to test your movement. So I'm going to stand up just so I'm out of the way. I'm going to have you, if you're able to, can you move your knee from like side to side a little bit? Can you cross it over your other? Are you able to cross this one? I'm going to help you actually with the passive movement. Good job. And this one over that way. Good job. All right, now are you able to kick your leg up? Good job. Now, I'm going to explain this one just for the sake of time. To test the extension for the knee, we would have the patient lay on his stomach and we would have him kick backwards so that he could, we could test to see how far he can extend it. So now we're going to test your ankles. So I'm going to get down on the ground again. I'm going to just examine the ankles. Can you see me? Yes. Okay. Now I notice that they are equal bilaterally. I don't notice any redness or swelling. I am just going to palpate them. And I don't feel any obvious abnormalities at the moment. What I'm going to have you do, can you take your foot, I want you to move your whole foot in a circle, like a whole rotation. Good job. All right, now I want you to extend it by bringing your foot upwards and flexing it by pointing it down and move it from side to side, internal and external rotation. Good job. Now, moving on, we are going to now test some of your neurological, I might have you move down on the couch just a little bit, just so I can be in the frame. We're going to test your neurological mental status exam. So moving on, if there is anything I forget from the musculoskeletal or from the abdomen, I might just throw it in, but we are now going to move on to the neurological exam. So for the first one, we are going to it's olfactory. Normally, we do not test olfactory in an office, but for the sake of the video, if I were to test olfactory, which is smell sense, I would take an alcohol swab, some cinnamon, hold it under his nose. We might plug one nose and wave it under and have him have his eyes closed and then just tell me what what he smells. So that is one way to test that. The cranial nerve 2 that we're going to test is optic nerve, which tests for acuity. And we're going to be going in with our ophthalmoscope, and we're just going to be looking at our eyes, and we're going to be looking for the red light, and we're going to be going in on each side. Okay. And another way to test for acuity is to use this Snellen chart. I don't have one on hand, but what we would do is you would stand 20 feet away with it and have the patient read a line and tell us the furthest down line that he can read, and then whatever his vision is, we would state it, say 20 over 20 vision. So he at 20 feet can see what someone else at 20 feet can see. So now we're going to be moving on to the third cranial nerve, which is, I believe, ocular motor, and this is how we test for pupillary accommodation and perla, pretty much. So what I'm going to be doing is we're going to be shining a light in his eye, and I'm going to have him stare straight ahead at me, and what I should be seeing is one pupil constricts while the other one does not. So we're only going to shine a light on one eye at a time, and another eye, and we'll do it one more time. Okay, so what we do see is that we have brisk, round pupils reacting to light. So we have pupils are equal and reactive to light and accommodation. So that is cranial nerve number 3, ocular motor. Oh my gosh, I can't speak, I'm sorry. Then we have cranial nerve 4 and cranial nerve 6, which is trochlear and abducens. This tests your extraocular movements, so EOMs. So what we'll be doing is I'll have him stare straight ahead of me, and I'm going to be taking my finger and moving it in an H formation, and he will just have to follow my hands. So stare straight ahead at me, Kenny, and without moving your head, just move your eyes, okay? Follow my finger. Okay. Now I also want to test for convergence, so I am going to have you still stare at my finger, and I'm going to move it in towards your nose. Good. So I notice that his eyes are converging inwards, almost to look cross-eyed when I do that. Now I do want to test his ability to do a finger-to-nose test. So I'm going to hold my finger here. I want you to hold your pointer finger up as well. Good job. Now you're going to touch your finger to your nose and then touch it to my finger, okay? So just keep doing that, finger to nose, and touch it to my finger. Finger to nose, touch my finger. You can move your head for this. And just keep following. Good job. Good job. Okay, so we show that the patient is able to have the reflexes to be able to follow my finger. We are now going to move on to cranial nerve number 5, which is trigeminal. This is the motor and sensory. So I have I have a Q-tip here that I have one end cotton ball and I peeled off the other end. So what I'm going to be doing is I'm going to be touching his face with the soft end and the hard end and having him tell me if he feels soft or smooth. So close your eyes for me. Tell me if this is soft.
Soft.
Or hard.
Hard.
Okay, good. All right. All right. And so the next thing what I'm going to be doing is we're going to be moving on to cranial nerve number 7, which is facial. So I want you to smile at me, frown. Can you puff out your cheeks? Like, can you raise your eyebrows? Okay. And I want you to grind your jaw together, like clench your teeth.
Oh.
Clench your teeth. Good job. So that included cranial nerve, or the cranial nerve number 5, trigeminal for the motor, and then the facial nerve for all of the facial movements. Now we're going to move on to cranial nerve number 8, which is acoustic. So I'm going to cover one ear, and I'm going to whisper a 2-syllable word. I'm going to whisper baseball and apple, and he's going to tell me if he can hear it or not. And you're going to repeat what word I said.
Baseball.
Good.
Apple.
Good. All right. So now we're going to be moving on to cranial nerve number 9 and number 10. These are the glossopharyngeal and I believe the vagus nerve. So I'm going to have you open your mouth for me. Good. And I do notice that his uvula rises midline. And good job. Now stick your tongue out for me and just move it side to side. Good job. And this is a great part to also examine the tongue just for any lesions, masses, abnormalities, anything like that. So now we are going to move on to cranial nerve number 11, the spinal nerve. So we kind of already spoke about this earlier and performed it, but I'm going to have you shrug your shoulders for me. Good job. And cranial nerve number 12, hypoglossal. We already performed this, but one more time, stick your tongue out for me. Good job. And we can see that the tongue is midline and it does not deviate towards the left or towards the right. So let's see. Let's, I don't want to miss anything. We're going to just check some more of your reflexes. I do want to check your Babinski reflex, which is on the bottom of your foot. So I'm going to take this sharp off. It's not so sharp, but it is pointy. And we're going to pretend this is the heel. We're going to bring it upwards, and the toes should curl downwards. If it goes up and fans outward, that is a positive Babinski that requires immediate intervention. So I'm going to have you put your foot out, and I'm just going to... Okay, and the toes did go down. We already checked your patellar reflex. I'm going to check your Achilles reflex, so it's just behind your heel. And I do notice that his leg did shake a little. So we've already completed the patellar, the Achilles. We are going to move on to our reflexes in our arms. So we're going to be doing our brachioradialis. And I notice that there is a little bit of movement within the arms. It's not major, but it is enough that I can still see it. It might be hard to see on the camera. And I believe that is most of the exam. For the abdominal, for the neurological, and for the musculoskeletal exam. Did we have you walk? I'm going to have you stand up real quick. We're going to have him just walk heel to toe for the tandem walk. Just walk heel to toe for me. This is to test his gait stability. Okay, good job. And come back, sit down. Good job. Good job. All right. Now that concludes our examination. Thank you so much, Kenneth. I appreciate your time.
You're welcome.